Welcome back to my channel. We are discussing antihypertensives, and today we'll be specifically looking at the beta blockers. Previously, we discussed what hypertension is, what some of the medications like the ACE inhibitors, like the angiotensin receptor blockers, and their main effect and the side effects. So today, as we continue, my name is Caroline Mutes. Welcome to my YouTube channel. And don't forget to subscribe. If you haven't subscribed, please, this would be the time. So, beta blockers. So these beta blockers help to reduce the speed or the heart rate and the force of contraction of your heart while lowering your blood pressure. They work by preventing a hormone called adrenaline or epinephrine from binding to the beta receptors. There are so many beta receptors, not so many, but there are 3 beta receptors, and they are located in very different places. So there are mainly 2 types of beta blockers. We have the non-selective beta blockers that will target all the beta receptors, and we have the cardioselective beta receptors. One way of remembering the names of beta receptors, we have this memory lane of baby beta is LOL. So most of the medication or all the medication that are beta blockers will end with LOL, atenolol, and whatever. What are the major indications for beta blockers? We have chest pain, also called angina, congestive heart failure, hypertension, arrhythmias, post-tachycardia, myocardial infarction, migraines, anxiety, and glaucoma. So, let's look at the beta receptors briefly. So the beta-1 receptors are found mainly in the heart and the kidneys. So when activated, they do the following. Those that are in the heart will increase your heart rate. So your heart will pump faster. They will also increase your heart pumping force, or what we call the contractility. Those in the kidneys, they will activate the release of the renin, an enzyme found in your kidneys. And if you've watched the earlier videos, renin is responsible for the conversion of angiotensinogen to angiotensin 1, which is also converted by the angiotensin converting enzyme produced by the lungs into angiotensin 2, which is a very vasopotent constrictor. So if these beta 1 receptors are stimulated, we will have an increased heart rate, an increased contractility of the heart. There is a renin that will be produced, which at the end of it all will have vasoconstriction and production of aldosterone, which will cause reabsorption of sodium and water. So at the end of it, we'll have an increased blood pressure. The beta 2 receptors, these are mainly found in smooth muscle tissue, the tissue in your respiratory system, especially your trachea or bronchial tubes, the blood vessels, and your nervous system. And when these are activated, they affect various body systems fall in the following ways. So if the receptors in the respiratory system, this can cause smooth muscle to relax, so someone can breathe more easily. So every other time you give a beta receptor medicine, this person will breathe easily if they had some bit of bronchoconstriction. In the vessels, it can cause smooth muscle to relax, hence lowering the blood pressure. In the liver, it activates the liver's conversion of glycogen into glucose, which the body uses for energy. In the heart, it increases the pumping force and the heart rate. In the nervous system, it can cause muscle tremors. So every time you give a medication that targets beta 2, it will have such effects. Then we have the beta 3 receptors. So beta 3 receptors are found mainly in the fat cells and in your bladder. And when they are activated, they do the following. They cause the fat cells to break down. They cause relaxation and increase in bladder capacity. They cause tremors, which limits potential medical applications for beta-2 receptor targeted medications. And then we'll look at our major types of beta blockers. So if you're given a beta blocker, this will target, if it's a non-selective one, it will act on all the beta receptors in your body, which we've discussed, where there is beta receptors 1, 2, and 3. So the side effect of giving these is more than when you give a selective beta blocker. So you should know that this pose a slightly higher risk of side effects, especially for people who smoke or have lung conditions such as asthma, chronic obstructive pulmonary disease or COPD. And if you remember, there are different sites and location and the effect thereof. You know that every time you give these non-selective beta blockers, for example, in someone with lung disease, the receptors, beta receptors, if we give medication that enhance their activity, their trachea, the smooth muscle around that area will relax. However, if you give a blocker, it means it will do the opposite, hence causing severe effects. So the best way to remember these drugs, it's a bit complicated, but this is how I would remember them. It's the C plant. So leave out the A, but C plant, where the C is the carvedilol, the P is the propranolol, the L is the labetalol, the N is the nadolol, and the timolol. Those are some of the examples of the non-selective beta blockers. So every time you give these, know that they could be contraindicated in people with lung conditions. And then we have the second type, which is the cardioselective beta blockers. So these were designed to target only beta-1 receptors in the heart cells. They don't affect other beta-2 receptors and are therefore safer in people with lung conditions. And the best way to remember this is the cardiobam, or the cardioselective beta blockers, the BAM. So B is for bisoprolol, acebutolol, atenolol, and the metoprolol. Those are some of the examples. So the side effects, like I said, most of these, the commonest side effect will be hypertension, because we are targeting to reduce the high blood pressure. So the first is bradycardia, hypertension, arrhythmias, fatigue, dizziness. They can also cause nausea, insomnia, sleep changes and nightmares, dry mouth or eyes. And this is rare, but it can happen, where someone can get sexual and erectile dysfunction. We need to be very careful when using beta blockers, and these are nursing considerations. So before beta blockers are prescribed, one should consider if a patient is having the following to prevent any adverse effects. One is having moderate to severe asthma. If someone has arrhythmias, if someone already has bradycardia, someone is already hypotensive, if someone has Reynolds phenomenon, and if someone has hypoglycemia. These are contraindicated situations where you can't, or you may need to monitor someone closely in case you put them on beta blockers. Let me explain some few. In hypoglycemia, the reason why we want to be careful giving beta blockers is the side effects of beta blockers mimics the symptoms of hypoglycemia. So if someone is diabetic and you give them beta blockers, they may not know if the symptoms they're experiencing is due to that drug or is due to their hypoglycemia. So you need to watch out on that. Raynaud's disease is a vessel disease where there is limited circulation to the extremities. So if, for example, you're giving a drug that will limit blood pressure or the pumping of the heart and the rate, you need to watch out in someone who already has saturated compromise. Hypertension, that I've explained. Bradycardia, we said the reason why we have beta receptors is that medication that work on those receptors increases the heart rate. So if you give a beta blocker, it will act otherwise, same as arrhythmias. For moderate to severe asthma, we said the receptors in the lungs or the respiratory system will help the muscle, the smooth muscle, to relax. If you block those receptors or the effect of those receptors, that muscle will constrict, so someone can have issues. Thanks for watching. I know that has given you enough information about beta blockers, and if you're checking your treatment or your lists of drugs that is on your prescription, right now you're sure whether you have a beta blocker, you're sure if you have an angiotensin receptor blocker, or if you have an angiotensin converting enzyme inhibitor. Thanks for watching. Next time we'll be looking at the calcium channel blockers. Don't forget to watch, don't forget to like, don't forget to share. Most importantly, don't forget to subscribe at Life with Nance Carol. Bye-bye.